Tonight, we're learning more about the death of country music legend Naomi Judd and digging deeper into the topic of mental health in seniors. Judd's daughter, Ashley, sharing more details about her mother's death nearly 2 weeks ago, telling Good Morning America that her family had asked her to shine a light on mental illness. Ashley Judd says her mother used a gun, adding that she was unfortunately the one who found her. Naomi Judd was 76 years old. WFXR's Rian Lowndes spoke with a psychologist about the impact of mental health in the aging community. She joins us now live in studio. Rian, we've talked a lot about suicide prevention and spotting the signs, but a lot of that has been geared towards things you might notice in younger people.
Well, Kathleen, that's exactly what I spoke to Harry Mustard about. He's a clinical social worker with Psychological Health Roanoke who specializes in geriatric issues. He emphasized that younger people are really struggling right now as we move out of the pandemic, but it's a silent issue among older generations.
Older people, just by their nature, are more isolated. They don't go out as much. They're not as mobile physically. Maybe they can't be. There are more health concerns as we get older. And then with the pandemic and COVID, it's just made them, in a way, much more anxious.
Seniors who were already at risk suddenly became much more vulnerable. And that distance they had to put between themselves and friends or family can make poor mental health worse, says Mustard. But he adds it's a more quiet struggle with the older generation.
We were brought up with the idea that it's a source of shame to have any mental problems, so especially if you're a male.
Friends and family might want to help, and Mustard says the biggest thing is to show up and listen.
As we say, 2 big ears and 1 small mouth.
But he adds that elderly people are often told what to do, and he says encouragement will be more effective. Motivating your loved ones to exercise, expressing concern about how they're doing are a couple of things you can do.
If you have a parent or grandparent who is older in their 70s or 80s or whatever, to show up and keep in touch.
Mustard says if you find yourself feeling down or you're even thinking about hurting yourself, making changes can be hard, but it can make a difference. You can also reach out to the National Suicide Hotline at the number on your screen if you or anyone you know seems to be in danger. He says you have to change your behavior first before feelings change. Kathleen, back to you.